Hello and welcome to my presentation of Can Marijuana Be Used as a Complementary Alternative Medicine to Help Better Control Blood Glucose Levels for Patients with Diabetes mellitus type 2. Diabetes mellitus type 2, previously known as adult onset diabetes, is a condition which affects millions of Americans. This disease is the result of body cells becoming resistant to insulin and or the result of the pancreas not making enough insulin for glucose transport into the cells for energy. There is a plethora of drugs on the market for the treatment of diabetes type 2, and all of them have detrimental side effects for the patient, as well as a burgeoning cost due to the need for ongoing lifetime use. Unlike diabetes type 1, type 2 is a condition that is partially curable. An active lifestyle and a well moderated diet can lead to lower blood glucose levels, decreasing the need for drug therapy to control the condition. However, dramatic lifestyle changes are hard for the patient to initiate and even harder to maintain. There is another possibility to lower blood glucose levels in order to lessen the use of the diabetic medications, and that may be marijuana. Cannabis, otherwise known colloquially as marijuana, has for years been used as a natural remedy for many ailments such as insomnia, nausea, and general body pains. Due to its history of illegality, marijuana has limited research into true medicinal value. However, in the past decade, there has been a growing body of evidence to indicate that marijuana may be helpful to diabetics in lowering the main markers of diabetes. Additionally, there is mounting evidence to suggest that marijuana may also aid those who are pre diabetic from becoming diabetic. This and the fact that marijuana is cheaply produced and has little to no detrimental side effects makes marijuana an ideal therapy to help better control type 2 and thereby decrease the need for the standard diabetic drugs. Diabetes mellitus type 2 is measured by different factors: homeostasis model assessment of insulin resistance, fasting glucose levels, fasting insulin levels, body mass index, and hemoglobin A1C levels. These measures of fasting glucose and insulin levels, insulin resistance, and components of the metabolic syndrome are ultimately what determines the diagnosis of diabetes mellitus type 2 and its precursor, prediabetes. Higher than normal values for these markers are the determinant factors for the diagnosis of diabetes mellitus type 2. The results of the research performed by Penner, Butner, and Middleman in the article The Impact of Marijuana Use on Glucose, Insulin, and Insulin Resistance Among U.S. Adults found that there is a correlation between past and present marijuana users and lower levels of fasting insulin, glucose, and insulin resistance. This gives the impression that marijuana can be therapeutic in the treatment and prevention of diabetes. The development of diabetes type 2 is directly correlated to obesity and metabolic dysregulation. Obesity is associated with low insulin sensitivity and glucose intolerance, and therefore a key part of any study on diabetes. Abdominal adiposity, obesity measured by abdominal girth, is associated with low insulin sensitivity and glucose intolerance due to metabolic dysregulation it causes. This dysregulation is often expressed through insulin resistance and glucose intolerance, which in turn is a direct cause of diabetes type 2. The study of marijuana users and their BMI is therefore an important observation. An American study of health and nutrition, it was found that mean BMI was lower in current marijuana users than non-current users in 10,623 adults. Because BMI is a significant marker for type 2 diabetes, this result gives strength to the argument of marijuana's positive effects on the treatment of type 2. The regulation of body metabolism is performed by many different systems. One of the key ones is the endocannabinoid system, which modulates food intake and energy homeostasis. Marijuana is a major source of cannabinoids that can and do act on the endocannabinoid system. These molecules can act as either agonists or antagonists to the receptors of the system, lessening the effects of that the endocannabinoid system has on a person. Since chronic overactivation of this system has been identified in obesity and type 2 diabetes, These cannabinoids can provide a way to prevent such overactivation. With the endocannabinoid system suppressed in this way, obesity and type 2 diabetes can be lessened or prevented. The fasting blood glucose level is a prime indicator of diabetes, and one that is tested daily by the diabetic in order to better control their disease. This is a measure of how well regulated the system is in regard to how glucose is managed during sleep, a period of lessened activity. However, fasting glucose levels can fluctuate and not give a true measure of diabetes or prediabetes. Therefore, fasting insulin levels are also measured in order to diagnose a diabetic state. It was found that compared with participants reporting never having used marijuana in their lifetimes, current use was associated with 16% lower fasting insulin levels. These findings are supportive of marijuana influencing fasting insulin levels, which in turn influence fasting glucose levels, a key indicator of diabetes. While it is true that fasting insulin levels and fasting glucose levels correspond to each other, no association was found between current marijuana use and fasting glucose was made after collecting all the pertinent data. As has been stated, insulin and glucose directly correspond to each other. Though marijuana may not directly influence glucose, its influence on the body's insulin does. Research shows that adipocyte insulin sensitivity was found to be higher in cannabis users compared with non-users, which is important to note because adipocytes are fat cells. This means that greater insulin sensitivity in adipocytes means more utilization of these cells, which in turn should help to lessen the two other factors for diabetes, body mass index and waist circumference. Body mass index and waist circumference are the two main factors to consider for the diagnosis for obesity. Obesity is directly related to the development of diabetes type 2 and is considered a hallmark sign of the pre-diabetic state. This is due to the excess fat and weight highly contributing to metabolic dysfunction that causes the diabetes. Research shows that current marijuana users had lower odds of the metabolic syndrome than never users. However, this does not directly correspond to less BMI and waist circumference. Most of the research involving marijuana's effects on BMI and waist circumference is confounding. Some of the researchers found that there were no significant changes in parameters including weight, waist circumference, and hip to waist to hip ratio. However, they also make the assertion that there are other factors at play regarding these measurements. Factors like genetic predisposition, cigarette smoking, and age were examples for factors that were not extensively included in this analysis, and could be skewing the data. In fact, not all the data reflected that waist circumference was unaffected, in that current marijuana use is associated with smaller waist circumference. Marijuana use has a positive impact on different factors that contribute to diabetes type 2. However, there are other health considerations to be made in concern of its use. The primary method of ingestion is smoking. Smoking itself is a harmful activity that injures the lungs, raises blood pressure, and causes stress on the heart. Marijuana is also still considered an illicit drug by many states and in the view of the federal government. In addition to legal dilemmas, illicit drug use might per se not cause a decline in metabolic health, but it might be an indicator of propensity to use drugs or overall deleterious health behavior or causes declines in overall health, which could balance out any benefits that marijuana may have on diabetes. In conclusion, marijuana use might be an ideal alternative drug to help treat diabetes type 2. It has been shown to significantly lower markers of diabetes such as fasting insulin levels, fasting glucose level, insulin resistance, BMI, and waist circumference. It is relatively cheaper than the normal medications, and being a plant, it is renewable. Marijuana should not be considered to replace the normal medications to control diabetes, but can be used in conjunction to lower the need for the others. There are still health concerns with marijuana use, such as smoking. However, there are other ways to ingest the product that would not be harmful, such as edibles and solutions. Due to the comparatively sparse and still new research on marijuana, consideration should be given to funding new studies that overcome the limitation of those that have been published. More research is needed to fully understand how marijuana can be used to treat diabetes, but present research resoundingly puts forth that it does show significant effects on the disease, and therefore it can be used to do so. So the question is, can marijuana be used as a complementary alternative medicine to help control better glucose levels for patients with diabetes mellitus type 2? And the answer is conclusively yes, it can. Now the other part of this question is, can it be used? It's still illegal in many states, and it's still illegal federally. So it can't be used by those who have diabetes in those certain states that is still illegal. So policy change needs to be made to allow for the research and development of the medicinal properties of marijuana and the accessibility to diabetics all around. Thank you for watching.